Hello to the Open Door community. My name is Dr. Daren Wu, and I am the Chief Medical Officer for Open Door Family Medical Center. At Open Door, we are aware that the coronavirus outbreak is causing a lot of fear and worry for our patients and in our communities. Believe me, all of us in Open Door feel the same feelings as you do. In this video, I hope to address some of these concerns, and I will share some of the tips about how you can best protect yourself and your family. We know some of you are experiencing very long wait times when you call us, and that can be extremely frustrating. Due to the high volume of calls and the questions that we are getting from patients regarding coronavirus, our phone wait times have in fact been a lot longer than usual. Please know that we are doing everything we can to improve the situation, and although we have increased the number of operators answering our phones, that may not be enough. We have also added the ability for you to schedule an appointment or request an appointment simply by emailing us. To make an appointment by email, just email the link below, which is hello@odfmc.org. That's HELLO@odfmc.org. For existing patients, another way you can get in contact with your care team or to communicate with your provider is through the Open Door patient portal. You can access the Open Door patient portal right from our website. And if you need any assistance setting up the account or logging in, please know that we offer a patient support line at 914-488-6318. Common questions that we are getting include, what qualifies someone for testing? And why can't everyone be tested for coronavirus? I assure you, in Open Door, we are following the guidelines set forth by the CDC and the Department of Health, both of which make the recommendations for testing with the understanding that there are not enough test kits to go around to test everyone who would like to be checked for coronavirus. Just as importantly, there is not enough personal protective equipment, such as face masks, gowns, and gloves, for clinicians to safely provide more testing. You may be aware from the news, doctors' offices and most importantly the hospitals in Westchester and New York City are all facing severe shortages of personal protective equipment. We know the testing criteria seem very limited, and that is frustrating to have to go by, but at this time we simply cannot test every single person for COVID-19. We must prioritize those patients who have symptoms such as fever, coughing, and trouble breathing, and as well who meet higher risk criteria including age over 50, or have compromised immune systems, or chronic conditions like asthma, diabetes, or cardiac or heart disease. If you are feeling sick and yet your symptoms are mild and do not meet the criteria for testing, please stay at home. That is the advice that the CDC and the Department of Health are both giving, and that is Open Door's advice as well. Most people, more than 80%, will recover without any special treatment and can do so safely just by recuperating in their home. Clearly, if you are feeling ill and are resting at home, please do call us if you're experiencing worsening symptoms such as very persistent or high fevers, worsening shortness of breath, prolonged and persistent coughing, or chest tightness or chest pains. But if you do not have these symptoms and are only feeling mild symptoms such as a little bit of cough, low or no fever, I cannot stress how important it is for you to stay at home and away from others in the community. This virus is very easy to pass on to others, and some people are in danger of becoming very seriously ill and having health complications, even death. We need everyone in the community to help be a part of this fight against coronavirus by not spreading it amongst one another. This means not going out, or if you do go out, to be at least 6 feet apart from one another, which is the definition of social distancing. This includes not being in large groups or avoiding large gatherings. Once someone has been diagnosed with coronavirus or COVID-19, what should he or she do? And just as importantly, what should those around this individual do? As mentioned previously, the most important thing is to rest at home, if at all possible, if the symptoms are mild. Just rest at home. Maintain contact, a connection with your clinician's office so that you can report any worsening of symptoms. If your symptoms are in any way getting worse, your clinician care team needs to know. And while at home, try to separate from others as much as feasibly possible. Stay in a separate bedroom, away from others, if that's possible. And if you can use a separate bathroom, that would be ideal. If these are not possible, maintaining social distancing to the extent that is practical and wearing a face mask when around others is advised. Remember, the best way to prevent the spread of coronavirus is to avoid exposing others or being exposed to this virus. Some general recommendations for all of us to follow include washing our hands. Clean those hands often. Still, the number one public health message to prevent the spread of coronavirus is to clean hands and to clean them often. Avoid contact with others. Social distancing means maintaining at least 6 feet away from others. If you are going to cough or sneeze, please cover that cough or sneeze by going into your elbow. Wear a face mask if you're sick and around others, and be sure to clean and disinfect your surroundings. Public health experts and doctors are confident that the sooner everyone complies with recommendations for social distancing and staying at home if the symptoms are mild, the sooner we can all go back to our normal lives, and the sooner we can all enjoy our wonderful communities again. Thank you very much.